Hi everybody, this is Dr. Sham. I am a rheumatologist practicing in Chennai. See, this video will be on main thing is everybody, not just rheumatoid arthritis. I think in general, people are worried about the side effects. Is it true? Like it's like once you take a drug, definitely you'll end up with the side effect. Is it really true? And many times people get offended because the doctor has given either a steroid or he has given a painkiller. Or some patients, if they develop what you call a bad tummy or a stomach pain after a tablet, they usually tell there is something called as given a high dosage. See, remember, there is nothing called high dosage, low dosage. Always it is the correct dosage. See, for all of us, if it is a drug X, you have a dose range. You start it from 5 mg, you can give till 20 mg, 25 mg. So we will be giving in the dose range. You usually start it low and gradually titrate. Remember, every medicine may not suit for all the patients. See, for example, one of the common drugs we use most of the things for a headache or fever is paracetamol. It's usually a harmless drug, but there are patients who will end up with complications even with paracetamol. I have a friend who has an allergy, who is allergic to paracetamol. There are patients who are allergic to paracetamol. So it depends whether that particular person can tolerate that particular drug. So in case if you are not able to tolerate, immediately go and stop the medicine immediately. Go and tell the doctor so that the doctor changes to an alternate medicine. And as I told already, I think in the previous videos we discussed adequately, like why a doctor who treats like a rheumatologist, rheumatoid arthritis or any other inflammation gives the steroids or painkiller initially. Remember, I am again stressing initially because it's a temporary one. Just because our drugs take time to act. See, if our drugs are going to act on the day or the next day itself, we are not going to do that. But luckily now we are something called, as I mentioned, small molecules. These are the drugs, unlike our conventional drugs, do act a little bit faster. Even by 2 to 4 weeks, we do expect a response. So the reason for giving this is that, so in case if you have any apprehension or if you don't want to take, you can always tell your doctor and you can avoid. For example, there are patients whose pain is manageable. They tell, I can manage the pain, and they try to avoid a steroid or painkiller. And this is some of the things we commonly hear. So I just put it on steroids cause kidney problems. See, I'm not telling steroids should be taken on a long term or it's a very good drug. As any drug, if used properly under guidance with proper monitoring, it's a very good drug. Remember, steroids never cause renal failure. It never causes any organ damage. There are other side effects, as I told, like having weight gain, cataract, diabetes, osteoporosis. These are the long-term side effects, or immunity can be suppressed. So in short term, except for weight gain, steroids is a relatively safe drug in comparison to a painkiller, according to me. So painkillers, usually I use less common than steroid, particularly in patients with rheumatoid. If there is no other option, then we do use a painkiller. For example, somebody with the uncontrolled diabetes like that. So remember, again, these are some of the myths people are worried about. So which is totally wrong. At the end of the day, two important things. So whenever we give any medicine in modern medicine, whether it is for rheumatoid or anything, all we see is benefit, side effect. So benefit should be here, side effect should be here. Always we see what is the risk benefit ratio. So that is the important thing we see, and that is how we give. See, the risk will be very minimal, but the benefit it's going to offer is going to be much more. So that is the principle based on which modern medicine is based on. So that is the reason we can never tell there is something which has zero side effects and has only 100 benefits. It will be always 10%, 20%. There is a risk of side effects, but the benefit will be, again, it will be 80, 90%. There is no 100%, because as I told, medicine is about probability. If you treat 100 patients rheumatoid arthritis with the same medicine, 60, 70 respond, remaining 20, 30 may not. They might need a better, different dosage or a different level of medication. So it depends on the individual, the disease level, and how they respond. But at the end of the day, all that matters is the quality of life. So remember that. And it's not that just because once I fell down while playing cricket, I will never play cricket. We can't, nobody tells like that. So that's sort of like, just because somebody had, or once you had, you can't totally go away from it, because the benefit it offers is going to be much more. Thank you.